Good day! I am Jascinth Calixtro, a level 3 nursing student from Visayas State University. Today, I will be discussing about infectious mononucleosis, the description of the disease, its pathogenesis, clinical manifestations, diagnostic and laboratory procedures, its treatment modalities, surgical management, nursing diagnosis, nursing management, and its prognosis. So buckle up your seats because I'm about to begin my discussion. Enjoy! Infectious mononucleosis. Description of the disease. Infectious mononucleosis, also known as mono, kissing disease and glandular fever, is a contagious illness typically caused by the Epstein-Barr virus. This infectious disease can be spread by saliva and the incubation period is 4 to 8 weeks. Pathogenesis. Infectious mononucleosis is caused by Epstein-Barr virus that is transmitted by contact with saliva in a susceptible seronegative host, lacks antibodies. The virus in the contaminated saliva invades and replicates within the epithelial cells of the salivary glands and then enters B cells in the lymphoid tissues, particularly tonsils, which possess receptors for EBV and cause infections of the epithelium. Inside the lymph node, there are lymphoid follicles and antigens displayed on the follicular dendritic cells. These cells recognize antigen and migrate to each of the follicle where they contact with CD4 helper T cells that provide activation signals. Activated B cells might bring back into the follicle and proliferate. Some of the B cells differentiate into long-lived memory B cells, while others become antibody-secreting plasma cells. These long-lived memory B cells serve as a lifelong reservoir for the virus. The infection spread throughout the body by the lymphatic system. Atypical lymphocytes is seen on an examination. Clinical manifestations. Clinical manifestation. Fever. Not surprising, happens in many infections. Pharyngitis. Cause of infection of epithelial cells in the pharynx. Lymphadenopathy. Cervical lymphadenopathy because cervical lymph nodes drain the pharynx and tonsils where the infection starts. But as we said, the infected B cells traffic throughout the lymphoid tissues of the body, so you can actually get lymphadenopathy everywhere. Fatigue. Normal when you get sick, but with mono, the fatigue is exaggerated. Atypical lymphocytosis. Normally, lymphocytes of the blood looks like this, but with a small nucleus and a very little cytoplasm. But in mono, you find lymphocytes in the blood that look like this, with a much bigger nucleus and lots of cytoplasm. We call them atypical lymphocytes, and what are they? They are reactive cytotoxic T cells that are trying to kill infected B cells. What does mononucleosis mean? It means there are a lot of mononuclear cells in the blood. And what are mononuclear cells? Well, they are WBC that do not have segmented nuclei, which neutrophils and eosinophils due the name mononucleosis. Refers that there are a lot of lymphocytes in the blood, but some of those, not all, are gonna be atypical. Splenomegaly. A spleen, you might know, has a lot of B cells, so inevitably infected B cells go to the spleen and cytotoxic T cell follow them, trying to kill them, and that makes the spleen swell up in about half of people with mono. Diagnostic and Laboratory Procedures. Blood tests or blood smear. Mono is confirmed by blood tests. Early in the course of the mono, blood tests may show an increase in lymphocytes. Some of these increased lymphocytes have an unusual appearance known as atypical lymphocytes when viewed under a microscope. Monospot and heterophile antibody tests. These tests rely on the body's immune system to make measurable antibodies against the EBV. The test detects proteins in the blood called heterophile antibodies that are produced by the immune system in response to an EBV infection. Treatment modalities. Eat healthy diet. Drink plenty of fluids. Drink plenty of fluids to prevent dehydration. Get enough rest. Mono makes you very tired. Sleep helps your body fight infection. Avoiding sports. Physical activity can put too much pressure on an enlarged spleen, increasing the risk of rupture. You should avoid contact sports and strenuous exercise while you're sick and for up to 4 weeks after. Medical management. Non-steroidal anti-inflammatory drug or NSAIDs ease fever, inflammation, headaches, and muscle aches. These drugs include ibuprofen, Advil, and naproxen aleve. Acetaminophen, Tylenol also works. Corticosteroids. Swollen tonsils may result to difficulty of breathing in some patients. Therefore, corticosteroids may be prescribed. Antibiotics. Treatment includes symptoms control such as the treatment of strep throat with antibiotics. Antiviral drugs may sometimes be used by physicians, but they may not be useful in most cases of mono-EBV infections. Surgical management. Splenectomy is surgery to remove the entire spleen. This surgery is necessary for spontaneous splenic rupture, which occurs in rare patients with EBV infectious mononucleosis and may be the initial manifestation of the condition. Nursing diagnosis and nursing management. Nursing diagnosis. Infection related to Epstein-Barr virus mononucleosis as evidenced by positive EBV blood smear result, temperature of 38.5 degrees Celsius, sore throat, and increased white blood cell count. Nursing management. Assess vital signs and monitor the signs of infections to establish baseline data. Administer the prescribed antibiotic for strep throat and corticosteroids as prescribed. Antibiotics are only used to treat strep throat. They do not treat a viral infection like EBV. Teach the patient to avoid direct social contact as much as possible and to perform proper hand hygiene in order to reduce the risk of spreading the EBV infection. Obtain a new blood sample for EBV smear to confirm the infection is completely treated. Nursing diagnosis. Hyperthermia related to mono-EBV infection as evidenced by temperature of 38.5 degrees Celsius, rapid and shallow breathing, flushed skin, profuse sweating, and weak pulse. Nursing management. Assess the patient's vital signs at least every hour. Increase the interval between vital signs taking as the patient's vital signs become stable in order to assess in creating an accurate diagnosis and monitor effectiveness of medical treatment. Administer the prescribed antibiotic and antibiotic drug medications. Remove excessive clothing, blankets, and linens. Adjust the room temperature in order to regulate the temperature of the environment and to make it more comfortable for the patient. Offer a tepid sponge bath in order to facilitate the body in cooling down and to provide comfort. Elevate the head of the bed in order to promote lung expansion. Nursing diagnosis. Fatigue related to anemia secondary to mono-EBV infection as evidenced by overwhelming lack of energy, verbalization of tiredness, generalized weakness, lack of appetite, and shortness of breath upon exertion. Nursing management. Assess the patient's degree of fatigability by asking to rate his or her fatigue level. Explore activities of daily living as well as actual and perceived limitations to physical activity in order to create baseline of activity levels, degree of fatigability, and mental status related to fatigue and activity intolerance. Encourage progressive activity through self-care and exercise as tolerated in order to gradually increase the patient's tolerance to physical activity. Teach deep breathing exercises and relaxation techniques in order to allow patient to relax while at rest and to allow enough oxygenation in the room. Prognosis. The long-term prognosis for most people with mono is excellent and severe complications are rare. Most people with mono recover completely with no long-term problems. References.
Thank you so much for watching. I hope you have learned a lot from this video. Click like, share, and subscribe to this channel for more educational videos related to medical surgical nursing.